Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over burns. So a complete overview of burns. So if you could first hit that subscribe button, it would be greatly appreciated because it truly does help my channel. So let's get started. So what is a burn? So a burn is tissue damaged as a result from heat, overexposure to sun, or other radiations. Okay, so it can be chemical, electrical contact. They can cause burns. So burns can range from minor to life-threatening emergencies. Okay, so it really depends on the extent of the burn is how we treat it. Okay, so treatment of burns, it depends on the location and the severity. Okay, so small sunburns and small scalds, they can be treated at home usually. Okay, now deep or widespread burns, they do need immediate medical attention. Okay, and then even some people, they get burned so bad that they do need treatment from burn centers. So specific places that they go, burn centers with month-long follow-ups. So symptoms. So burns can really vary on different symptoms, but it depends on how deep the burn goes. So they categorize this as first, second, and third degree burns, okay? And there are different symptoms for each. So a first degree burn, okay, it might be red and very painful, but you don't have like the blistering, okay? Now, second degree burns, this is where you're going to have the swelling, the redness, the white, splotchy skin, and blisters may develop, okay? Pain is extremely severe with a second degree burn. Now, our third degree burn, this is the worst burn. It's burnt all the way down to the fat layer. The burn may be black, brown, white, and the skin is, it might be leathery. But the burn goes so deep and it causes damage to the nerves, it actually causes numbness. So most of the time, like with third degree burns, they don't feel anything, okay? So when should we see a doctor? So obviously third degree burns, we need to seek medical assistance right away. Okay, if you have burns that are covering the hands, feet, groin, buttocks, major joints, or large portions of the body, you should be seeking out doctor assistance. Deep burns, so once again, that third degree burn all the way down to the fat, where we can't really feel the burns, you need to be seeking medical assistance. If the skin looks leathery, black, charred, or was caused by chemical or electrical, please seek medical assistance right away. If you were burnt and there is smoke involved, okay, so it was caused by a fire and there's smoke involved, this is very dangerous. So smoke inhalation can really affect our lungs and it can close our airways. Okay, so that would be a medical emergency to seek medical assistance right away. You want to call your doctor if you're experiencing any of the following. So signs and symptoms of infection, any oozing, increased pain, redness, swelling. Okay, get a hold of your doctor. A burn or blister that is large and doesn't heal within 2 weeks. So if you've had a burn and it's not healing within 2 weeks, please get a hold of your doctor. And then if you have any new unexplained symptoms or significant scarring, okay, those are times you'd want to get a hold of your doctor. So when we think of causes of burns, we think of something that was hot, something that was on fire, and it has caused a burn. But that's true, but there are a lot of other things that can cause burns also that we don't normally think of. So just like hot steam can actually cause a burn. Okay. Hot metal, glass, or other objects, electrical currents, okay, can cause a burn. Radiation, okay, from say x-rays can cause a burn. I have seen really nasty burns from radiation therapy before, when they're going in and getting treated for like a tumor, to shrink a tumor, and they're getting radiation. I have seen very, very horrible burns from this. Sunlight and ultraviolet radiation, even tanning beds, okay, can cause burns. Strong chemicals such as lye, paint thinners, or even gasoline can cause chemical burns on your skin. So what are some complications with deep, widespread burns? Okay, so bacterial infections, this can lead to an infection in the blood, so sepsis, okay, very dangerous. Fluid loss, dangerously low body temperatures, breathing problems, like I explained, from breathing in hot air or smoke. This can cause breathing complications over time. It may not happen right away, but anytime that you come in contact and there's been a burn and you've breathed in smoke, hot air, like extremely hot air, you want to go get checked out right away, because within a short period of time, it can affect your breathing, okay? And it's quite quickly. Scars, or bone and joint problems, okay? So this can be a problem when, especially in the hands, because if we start getting where we're having scar tissue, it can almost cause the hand to not be able to function properly. That's why I said, if you have anything on your hands, in joints, we want to go be checked out by a doctor, healthcare professional right away. Make sure that it's not going to affect our normal function of our body, okay? Okay, so just some preventative measures to reduce the risk of common household burns. So never leave any items that are cooking unattended. Turn all your pot handles towards the back of the stove, okay? This will prevent them from tipping over, especially if you have young children. You don't want them to pull on them and knock them over on top of themselves. You don't want to carry or hold a child while you are cooking at a stove, okay? Keep hot liquids out of reach of children and pets. Keep electrical appliances away from water. Check temperatures before serving any food or warm beverages to children. Never cook while wearing loose-fitting clothing. If a child is present, block his or her access to heat sources such as stoves, outdoor grills, fireplaces, and space heaters. Before placing a child in a car seat, so especially in the summer, so those buckles, they get so super hot, okay? So make sure that you feel that before you place them in it. We wouldn't want them to get burnt, okay? Unplug irons or other similar devices and store them out of reach of children. Use those covers for electrical outlets, okay? You should always have those safety caps, especially with children in the house. If you smoke, never smoke in bed. Be sure that you have working smoke detectors and change the batteries at least once a year. Have a fire extinguisher on every floor of your home. While using chemicals, make sure that you are wearing protective eyewear, clothing, gloves. Keep any chemicals away from children, and set your water heater's thermostat below 120 degrees Fahrenheit to prevent scalding, okay? A lot of times kids go up, they just throw on the tap. They don't realize that like one side's hot, one side's cold. They just click it on and it is what it is. We wouldn't want them to get burnt, okay? So if you do go to the doctor for burn treatment, they are going to examine you. If you have more than 10% of your body covered by burns, they'll probably send you to a burn center, okay? Or if you have very deep burns, or if they're on the face, groin, hands, feet, they will more than likely get you set up with a burn center. And then your doctor will check for other injuries, which might be like lab tests, x-rays, or other diagnostic procedures. So treatment. So a lot of treatment can be done at home, and normally the burns will heal within 2 weeks. You always want to run your burn under cool water, not cold water, cool water, and then leave it under there for about 15 minutes, and it will really help remove that heat from that burn and stop it from burning, okay? So that really does help. The goals of treatment are to control pain, remove dead tissue, prevent infection, reduce scarring, and regain function for the deeper, more severe burns. Okay. Now, medical treatment. So there is some different treatments to treat the burns. Okay. So just depending on what the healthcare professional says and what their best option is for this particular burn. So there is water-based treatments, such as ultrasound mist therapy to clean and stimulate the wound tissue. They'll give you fluids to prevent dehydration, pain and anxiety medication, burn creams, ointments. There's different types of wound dressings, drugs to prevent infection, and they will also recommend getting a tetanus shot. Okay, so some other treatments and therapies. So physical and occupational therapy. This can really help stretch out the skin and make sure that the joints remain flexible, okay? We don't want to have it where we cannot move our hands properly or extend our joints as they should. We want to make sure that we are doing the therapy and really keeping that flexibility. Now, surgical and other procedures. Now, these are for the really bad burns, okay? So like I said, with breathing in really hot air, steam, or smoke, our airway can become swollen shut. So you may need breathing assistance, feeding tubes, ease of blood flow around a wound. So if we have burn scabs that go around the complete circumference of an arm or a chest, this can start really constricting blood flow and constricting breathing. So it just depends on the signs, symptoms. The doctor may need to cut the scab to relieve the pressure and allow better breathing or better blood circulation. There's also skin grafts and plastic surgery that are also an option. So different home remedies. This is when you have a minor burn that you can treat at home. First step is we're going to cool down the burn. So put your hand or wherever the burn is under cool water and let that cool water just take out any of that heat that's there. Do it for 15 minutes. If you take out your hand and dry it off and you still have that burning sensation, do it for another 15 minutes, okay? You want to remove any rings or other tight items before the burned area starts to swell, because it will swell. Don't break any blisters, okay? They protect against infection. You just want to clean it with mild soap and water and apply a antibiotic ointment over top of it, but you don't want to break those blisters. You want to apply a lotion. So once the burn is completely cooled, apply a lotion that contains aloe vera, okay? Or a moisturizer. This will help. You want to bandage the burn, okay? Put a sterile gauze bandage over it, not a fluffy cotton. This will help keep area, this will help keep air off the wound, and it reduces pain and protects blistered skin. Okay. Take a pain reliever and consider getting a tetanus shot. Okay. If you haven't had one in at least the last 10 years, you do need a tetanus shot. So that's all I have for this video. I hope it did give you a better understanding of burns and what we do to treat them. I do have a few more videos on burns. I will link them in the description below or somewhere in this video, normally up in this corner. I will link one of the videos, okay? But that's all I have for this video. I hope to catch you in my next one. Have a wonderful day, guys.